All right, welcome to another episode of Medicine Mondays. I am yours truly, Dr. Pierre, your favorite board certified internist, host of Medicine Mondays, host of the Empower Yourself for Better Health series, host of our other YouTube channel, Dr. Pierre's Health Checks. Make sure you are subscribed to that channel as well. Today, we are going to be talking about men and heart disease. Of course, we are still in the month of June. We're still talking about Men's Health Month, and we've talked about prostate cancer. We've talked about just men in general needing to go see the doctor more often, but we have to talk about the number one killer, right? So let's talk about heart disease, and let's kind of give a good foundation of what heart disease is, so people can kind of get a mental picture of what we're really dealing with when we say, like, hey, you know what, heart disease is a problem. So heart disease, again, I'm actually getting this from Mayo Clinic. Heart disease describes a range of conditions that affects the heart, including blood vessel disease, coronary artery disease, heart rhythm problems, heart valvular related issues, heart rhythm related issues. So a lot of things kind of encompassing the aspect of heart disease and cardiovascular disease. And I usually will kind of preface it in the term of cardiovascular disease, because if you understand that the vasculature is associated with the heart, you understand why not only can you have problems in the heart, but you can have those same problems with vasculature causing problems with the kidneys. You have those same problems with the vasculature causing issues in your brain, aka stroke. The same issues you have problems with the legs, aka peripheral vascular disease, right? So when we think about cardiovascular disease, heart disease in general, especially with it being the number one killer in men, and this is the number one killer, about 1 in 4 deaths are related to cardiovascular disease. So this is a number that, again, has held the top reign as far as number one killer for a while. It doesn't seem it has a significant, unfortunate chokehold on our men, just really in general, men and women, but specifically men when we think about this. And today we're going to talk about the risk factors. We're going to talk about some signs and symptoms. We're going to talk about when they do have to come see the doctor. What are some diagnostic studies that the doctor would typically do to try to elucidate what is actually going on in their words, and then some treatment options at the end. So again, when we think about heart disease and we think about cardiovascular disease, right? So I want us to kind of think about it as one. So we got heart disease, we got cardiovascular disease, and it affects a lot of men. Again, I said 1 in 4 deaths due to it. Leading cause of death in men, the leading cause of death in any ethnic group. And when you think about like what is killing the men, heart disease is the number one killer. And half of the men who have died suddenly, it's been found, have had no reported history of any previous vascular disease. Now you may be wondering, like, how does like half the men who die suddenly have that occur, especially if they die due to cardiovascular disease? And again, I think that goes back to a lot of the men probably aren't getting the checkups that they're supposed to be getting. And if they aren't getting the checkups that they're supposed to be getting, then you don't know that you have, risk factors and signs and symptoms of cardiovascular disease. So again, that's why you watch a channel like this, listen to a podcast like this, because you want to know, what are my risk factors? What are my concerns? What do I need to be telling my doctor? Remember, empower yourself for better health, right? We have to empower ourselves with the knowledge. So we go to our personal doctor, right? Whoever your personal doctor happens to be. I know you may be watching this from the other side of the country, from the other side of the world. Whoever your doctor happens to be, you want to be equipped with the knowledge to say, hey, I read this, I listened to this podcast, I watched this video. Dr. Barry said, like, I need to ask these questions. Let me know what these answers are, right? That's what I'm here for. I like to call myself kind of the messenger for this. So let's talk about some risk factors associated with cardiovascular disease. These may be very familiar, right? Because these risk factors affect a lot of diseases, but definitely cardiovascular disease is one. Of course, the age. The older we get, our higher risk and higher chance of developing cardiovascular disease. Our physical inactivity, right? So if we are physically inactive and we are obese, we're older, again, all of these kind of risk factors associated with cardiovascular disease. Let's think about some medical things that we definitely know about. Diabetes, hypertension, high blood pressure, high cholesterol. These are all problems that we know kind of add to that bucket of cardiovascular disease. More importantly, let's think about the things that, we definitely could be changing, should be changing. Drug use. The drug in particular I'm thinking about is that big bag cigarette. The cigarette smoking is putting gasoline on a well lit fire when we talk about heart disease and cardiovascular disease. So cigarette smoking, definitely not a thing we should be doing. Liver related diseases, alcohol related diseases, all of these things can cause a problem associated with cardiovascular problems, right? So when we think about some of our risk factors, we know that there's even some ethnic related risk factors, right? Just being African American, we know puts you at a higher risk for heart disease. Big thing, and I always say there's things that we can change and there's things that we can't change, especially when we talk about risk factors. One of the biggest ones that we can't change, guess what, right, is our family history. So you have to know, and you'd be surprised the amount of people I see in a hospital, I used to see in a clinic, who had no clue of their family history associated with medical related problems. So if you don't know that your family has a history of cardiovascular diseases, if you don't know your family has a history of cancer related diseases, if you don't know your family has that type of history, you don't know to check for yourself. So if you're watching this, listening to this, please, if you can't answer that question right off the top of your head, hey, my dad has a family history of this, my mom has a family history of this, my uncle has a family history of this, my brother, like if you can't answer those questions like that, go run to your doctor right now. Go call your family right now. Get in line, get empowered for your benefit, because it's only going to help you. Because as the physician, when I go to see you and I ask these questions, if you have no clue, I'm not going to put that like, oh, he has no family history. I'm going to say he doesn't know his family history, because it's more important for me to kind of think about like, hey, does this person know their family history or does this person not know their family history? Especially when I'm trying to what we call risk stratify a person. And the risk stratification we'll talk about later on really helps us when we're thinking about like, hey, what type of testing do I need to do for this patient in front of me? Like I could tell, we kind of mentioned, half of men who died suddenly had no prior history. My father, when I was in medical school, so I was a first year medical student, passed away, boom, like woke up, went to bed, did not wake up, passed away suddenly from cardiovascular diseases. Had recently, like maybe 2 to 3 weeks prior, he was in a hospital, found to have significant uncontrolled blood pressure, found to have needed a cardiovascular aortic stent for an aneurysm, like all of these things that he had no clue what was going on with him until, again, the chest pain was worse and everything, until these symptoms happen. So again, you don't want to, and there's a lot of men who usually get introduced to the medical system that way, where they've been avoiding us, and then when they do see us, hey, guess what? You have like 3 or 5, like that's always the worst part, especially when I was doing outpatient medicine, when a person would come to me as a new patient visit, and I do my due diligence, I ask my questions, they say, oh, I don't have no medical history. Yeah, I haven't seen the doctor in 10 years, but I got no medical history. And then when I start doing my testing, I do my due diligence for my annual physical exams, and then all of a sudden I come to you on the next appointment, I'm like, hey sir, like, not only do you have uncontrolled blood pressure, your diabetes is uncontrolled, your cholesterol is uncontrolled, like all of these things, that your kidney function is worse, like all of these things that they had no clue about. So it almost seems like you're like putting all of this pressure like on their lap at one time, but it's not the case. It's just that's, when you came to see us, we had to diagnose how we had to diagnose. So those are just some of the risk factors for sure. I mean, again, we mentioned alcohol, we mentioned the cigarette smoking. So those are the big, risk factors that while we're asking you questions, we're thinking about. Because again, we're trying to put you in the low risk bucket, the medium risk bucket, or the high risk bucket, right? And the high risk bucket is for all of these, end stage effects, right, that cardiovascular diseases can cause. Of course, we know about strokes, right? Again, and that's why I want us to think about it in cardiovascular, not just the heart. Let's not just focus on the heart. Let's think about the cardio and the vessels associated with it. So you got vessels in the brain. If you have a decreased blood flow in the brain, it is a stroke. If you have that causes muscle tissue, is a stroke. If you have decreased blood flow in the heart, it is a heart attack. If you have decreased blood flow in your legs, now you have what we call peripheral vascular disease, and you may need a stent. You may need to get that foot cut off. Like anything can happen. So again, we want to think about the whole vascular system, right? When we think about cardiovascular disease, understand like how having disease one place means you might have diseases in another place. Because again, if you have disease in your legs, you have diseases in your heart. If you have disease in your heart, you likely have some form form or degree of disease in the brain, right? So it goes kind of hand in hand from that standpoint there. So early signs and symptoms associated with cardiovascular disease and when you should be going to the doctor to go get help quickly. You can have chest pain. You can have shortness of breath, right? You can have swelling in your legs, right? So you can feel like your heart's racing, what we call palpitations. Even the easiest one I like to say is like, are you able to do the things you used to be able to do with no problems? Like going to the mailbox or running or going up the stairs. If you start noticing that like it's taking a lot more effort and energy to do those normal daily things that you used to be able to do with no problem, you need to be concerned. And this is the big one. And this is the one that I think people don't talk about. Again, that's why I'm really trying to put everybody's head the vascular aspect of it, right? Erectile dysfunction. You would be surprised the number of people who come to me in my office, who I used to see in the office and who I see definitely outside in the hospital setting, who initial complaint was erectile dysfunction. Because remember, we talked about some of the reasons why men come to the office. Erectile dysfunction is definitely one of them. But now remember, to get your penis erect, that's a vascular related issue. So again, if you have vascular related issues, all of a sudden you have difficulty getting erect. Right. So we are able to diagnose a lot of heart related disease, high cholesterol, like all these problems just because they came in with erectile dysfunction. So again, like just don't think that a Viagra or Cialis is going to be enough. Like if you coming in with new signs of erectile dysfunction, we want to make sure like we're not missing heart disease. Definitely for sure. In that regard. So definitely don't think about, that's why I wanted to save that one for last, like the erectile dysfunction for sure. So let's talk about some diagnosis. Like how do I diagnose this? One, I get a good history. Right? I just get a good history. I ask you the questions that need to be asked. I ask about your family history. I ask about your social history. I ask about when last time you've been kind of in tune into the medical system. I ask about like, what is your energy level like? I ask if you're having any chest pain, any shortness of breath. I'm just asking great questions, right? So the first and foremost, when we think about the diagnosis of heart disease, is your doctor has to ask the right questions. So it's always important. We talk about it in medical school a lot, how the history and physical is usually, before we get any lab test, is usually tells the story. And we don't, the lab test and everything else we do afterward is just to confirm what we were able to diagnose from our history and physical. So asking a great history, bar none, will get you your answers, what you need to get to. Now let's say if we get those answers, right? We get a good history. Now some diagnostic studies. Of course, all of our lab related studies. Again, I'm going to check to make sure your kidney function is okay. I'm going to check to make sure your blood count is fine. I'm going to check to make sure no signs of infection. I'm going to check to make sure your electrolytes are pumping the way they need to be pumping. I may check your thyroid hormones as well, because we know if your thyroid is out of whack, that can definitely cause some issue with your heart related issues and vascular related issues. Definitely checking, make sure you're not a diabetic or not an uncontrolled diabetic, because again, we talked about our risk factors, being diabetes being one of them. Cholesterol, definitely going to make sure your cholesterol is on point where it needs to be. So a lot of things that we can test just from a lab work that we'll know like, all right, this may be, and again, we're just trying to put you in what bucket: low risk bucket, medium risk bucket, high risk bucket. We're just trying to put you in the bucket to see where do you fall when we call about our high risk, low risk, or medium risk diseases associated with heart disease. Now, diagnostic studies I can do, of course, the more common one we know is about the EKG, right? Because the EKG can give us so many different answers, because the EKG can tell me, one, if you're having a heart attack like at this moment. EKG can tell me if there's a problem I need to take care of right now, aka go to the hospital, get on the cardiovascular. Like there's some things that EKG could tell me ASAP, especially if you're coming in with shortness of breath, especially if you're coming in with erectile dysfunction, especially if you're coming in with chest pain. Like EKG is amazing. Chest X-rays and other imaging related studies, because there's a lot of things that can cause chest discomfort, chest pain, shortness of breath. So we want to make sure we don't miss those as well, because we don't want to be pigeonholed and focus on heart disease and not talk about any of the other stuff in that regards. We can do stress tests. We send to our cardiology partners to take care of that for us, right? Stress tests, echocardiograms, which essentially is an ultrasound of the heart One, because we talked about valvular disease associated with heart disease. So we want to make sure your valves are opening and closing correctly. We want to make sure the pressure in the heart and outside the heart is done and adequate. We can check to see if your wall motion, if your heart's pumping correctly and appropriately, how it needs to pump. And in that regard, so a lot of things we can pick up from the ultrasound. And if we have to do even further, like and again, let's say especially you're in a hospital setting, we can even do what we call a cardiac catheterization. So we can take a look inside the vessels of the heart, inside the legs, just to see if there's any disease that we need to take care of. Now, we do have some non-invasive things that we can do, right? We can do MRIs, we can do CAT scans of the vasculature. I know, like here, I'm in South Florida, so we have some imaging centers that will actually do what we call a calcium score, and they'll actually do an image of your heart, a CAT scan imaging of your heart, and they can actually give us a certain score. Now, again, it is not the confirmatory. It will just say like, hey, based off the imaging, like in the calcium buildup that I'm seeing around the heart, this is a person's score. Now, based on that score, do with it, it's still up to the doctor. Again, that's why I love the aspect of medicine. Medicine, a lot of these ancillary tests, still rely on the physician making the correct and reasonable decision for their patient. It's all about the standard of care we know is what is reasonable that like Dr. Pierre, I think is reasonable for the patient in front of me. And that's it. That's standard of care, right? So I base off my decision making based off all of the lab testing and imaging testing that I find. So those are some of the common image studies that we can do. Treatment, of course, let's end with treatment because we have to, right? What do we do, right? The first thing we're going to do is we're going to see if there's any lifestyle modifications that I can do, right? That can say, you know what? I think if we do some good lifestyle modifications, we don't have to worry about you getting a heart attack in 3 years or 5 years, me talking about you needing amputation, me talking about, hey, your kidneys are shot, you need dialysis. There's definitely some things that we can do before you get to that point there. So lifestyle modifications, that's what I'm telling you. Hey, stop smoking cigarette. Hey, stop the excessive alcohol drinking. Hey, you're not working out enough. Go work out more. So there's a lot of lifestyle modifications, diet. I forgot to put that as a risk factor, but of course, diet is a huge one, right? So we're going to monitor, we're going to observe your diet. We're going to do things to try to adjust your risk, again, to take you from the high risk bucket to the medium risk bucket and hopefully to the low risk bucket, right? So those are some lifestyle modifications. There's plenty of medication. It really just kind of depends on what we're dealing with. Are we dealing with a diabetic? Are we dealing with a person with high cholesterol? Are we dealing with an issue with thyroid related diseases? So it really kind of depends. The type of medications you'll be on will depend on the type of disease process I'm dealing with. If it's just blood pressure, I'm going to make sure you're on very good, adequate blood pressure regimen, right? If it's cholesterol, make sure you're on good cholesterol medication. If it's a thyroid related problem or a kid, whatever we need to do, plenty of medications are there, right? So we won't bog down ourselves, especially during this video, on this medication versus that medication. The important thing is understanding, what am I treating? Am I treating your blood pressure? Am I treating your cholesterol? Am I treating your thyroid related disease? What am I treating? And based on what I'm treating, that's the medication that's going to be the best for you. Again, make sure you talk to your doctor, to get the skinny of that. And if it, worst come to shove, right? And you end up seeing me in the hospital setting, and let's say you're having a heart attack, or let's say your feet has gone ice cold because the blood flow has essentially stopped. You may need some surgical intervention, but of course, as a physician, as an internist, I don't want you to get to that point. I want to do everything I can. Remember, at Lunch and Learn community, we're all about trying to prevent, right? Like, again, my goal is, I jokingly say it, but not really. My goal is to try to starve the hospital. I don't want you to have to come to the hospital because of issues that we could have taken care of, before you got there, right? Like, again, if you're obese, if you're a smoker, right? If you don't work out, like, if we can just take care of some of those things there, you don't end up having to come see me for your stroke. You don't end up having to come see me for your heart attack. You don't end up having to come see me because your feet are ice cold and there's no blood flow. And that's a surgical emergency for those who not realize it. Like, that's a problem. So you don't end up having to see me for that if we can stop it in the beginning. That's why it's so important for prevention, right? So again, that is is, that's really our skinny right this week on heart disease, cardiovascular. Heart disease, cardiovascular disease, the same exact thing. We just know that it's killing us. Hey, men, I'm talking to you right now. It's killing us, right? And it's been the number one killer for a long time. And it's up to us, right, to change what we can change. Again, we're not saying the family history, your age, hey, it is what it is, right? But there's a lot of things that we can change. And I think it first starts with you, right? Going to see your doctor, getting that checkup, making sure that you are the healthiest fit person that you can be. Because remember, it's not just about you, right? It's about everyone who's around you, who depends on you being there, who depends on you being the most physically, mentally, spiritually fit. Like that's just is what it is. Again, so I am yours truly, Dr. Pierre. I'm going to see you guys next week.